Hello, everyone. My name is Laura and I'm pleased to welcome you to the National Academies of Sciences, Engineering, and Medicine and to our monthly webinar series, Climate Conversations, Pathways to Action. I'd like to acknowledge that the National Academies Washington, D.C. headquarters are physically housed on the traditional land of the Nacotchtank, Anacostan, and Piscataway peoples, past and present. We acknowledge that the expertise held by different Indigenous communities is crucial to the work of understanding and addressing climate change. Our conversation today will be recorded and available to view right here after the event. If you'd like to ask questions, please submit them to the Slido box below the video at any time, and we'll incorporate them into the Q&A section of the programming. We also encourage you to participate in the polls that will appear in the same location and to give your feedback after the event in the survey linked above the video. Above, you'll also see a sign up for our weekly newsletter about upcoming climate activities at the academies. So for today's conversation, I'm really excited to introduce my colleague, John Ben Swallow, who will kick off our discussion. John Ben is a program officer with the Board on Environmental Change in Society and the staff lead on the recent National Academies report titled Community-Driven Relocation, Recommendations for the U.S. Gulf Coast Region and Beyond. John, over to you.
Thanks, Laura, and good day, everyone out there. As Laura mentioned, this edition of Climate Conversations grew out of a 2-year consensus study and a report that came out of that study. The study was sponsored internally by the Gulf Research Program Division within the National Academies. As a principal way to learn about climate-induced relocation in the Gulf region over the course of the study, we took a very community-engaged approach through a series of workshops in which we partnered with locally trusted community-based organizations to help us bring to the table people on the front lines of climate impacts along the Gulf Coast, from Florida to Texas. Those conversations and the stories we heard drove the content of the report and ultimately support the committee's conclusions and recommendations. Throughout all of that, a central message is that well-being, including the physical, social, and mental health of both individuals and communities, is paramount to effective decision-making and engagement processes around relocation, as well as for other climate adaptation and resilience strategies. I'd like to acknowledge my fellow staff in the Board of Environmental Change and Society at the National Academies for their dedication to this project, as well as our excellent committee that oversaw the study and co-authored the report through their service as volunteers. I'm also grateful to be joined by Halle Parker, who will be moderating our conversation today. Halle is the senior environment reporter who covers Louisiana's changing landscape, climate change, and issues of environmental justice for New Orleans Public Radio, as well as the Sea Change podcast. Her work has been featured nationally on NPR's Morning Edition, Here and Now, and All Things Considered, among other programs. Before entering the public radio world, Halle worked for various newspapers, including the Times-Picayune and the New Orleans Advocate. Halle, the floor is yours. Thank you.
Thanks, John Ben. Really appreciate you all inviting me to be here. And I'm so excited for our conversation today. I definitely don't think that talking about community well-being as it relates to community relocation is discussed enough. And so today we're going to start broad, talk about the larger landscape within this discussion and slowly get narrower and into the nitty-gritty with our experts we have here. Then we'll be talking about what the future looks like. So to start out, let's introduce our lovely panelists. First, we have Janice Barnes. She is the founder of Climate Adaptation Partners, a New York City and Asheville-based women's business enterprise that focuses on planning, advocacy, and partnership building for climate adaptation. She works from the intersection of climate change, design, and public health. And Janice also helps to advance resilient principles and connect knowledge across communities. And then we also have Perry Sheffield, and she is a pediatrician and environmental health researcher and professor at the, Perry, please correct me, is it Icahn or Icahn? Icahn? School of Medicine at Mount Sinai in New York City, where she co-leads the pediatric environmental health team. Her research also focuses on climate-sensitive health effects, and she is the principal investigator at an NIH-funded project on hot weather and health outcomes in children. So we're really lucky to have both of you here today. I wonder if we can just start by getting to know each of you and talk about what brought you into this space. Maybe Janice, we can start with you.
Certainly, and thank you, Halle, and thanks to everyone at the National Academies. I think John Ben and team need to have a big shout out because they were so central to the work that the committee was able to do, and really appreciate what you're doing with these podcasts, not a podcast, I can see you, these telecasts, because it just crowds in more folks in the conversation. And I think that's how I ended up in this group. There was an effort that the National Academies did a number of years ago that I was able to join. It's still ongoing, but a number of years ago, I joined called the Resilient America Roundtable. And it was just so incredibly helpful to have the range of experts come together and to share knowledge and kind of push one another to think more broadly. And the diversity of backgrounds that the National Academies brings to those conversations it's just been tremendous. I also spent part of my graduate years and then part of my professional practice years living in the Gulf region. So certainly seeing directly the kinds of issues that were raised here today.
Thanks for that, Janice. And Perry?
My background is in pediatrics, and I made it almost all the way through medical training before finding out that there was a field of pediatric environmental health. But I had, despite having an undergraduate background in environmental science. So I think that speaks to the siloing. And so now my subsequent 20-year career has been trying to break down some of those silos. And now I work as a pediatric environmental health practitioner based in New York, and had the pleasure to get to know Janice through a New York State climate impact report that we worked on together. And her background as an architect is refreshing to me as a health clinician. And we need more of that and more of these dialogues. So I'm appreciative to the academies for hosting this today.
Awesome. Yeah, and I wonder, since we are starting broad, Janice, if you could just maybe go over some of the basics about what community-driven relocation actually is.
Absolutely. I think that, first of all, terminology matters, and the committee in the community-driven relocation study started with a statement of task that's about managed retreat. And just that terminology is very indicative of the kind of trauma that we learn more about. So you can read more if you have a chance to take a look at the study about the deliberations around the language. I think that the outcome of using community-driven relocation is explanation somewhat on its own, which is to say the communities that are in harm's way have to self-determine the degree to which they want to make change, because what an outsider might perceive as a problem with a solution that means move, relocate, a community might see as one of many problems where the network of resources that are co-present in that community provide greater value than the stress of the hazard. And that's hard to say in some of these contexts, because the stress of the hazard is quite significant. But if a community member has a network of supports that couldn't be replicated through relocation, there are other chronic and acute issues that could appear. So that's the tough balance. And the language we use here is also about originating and receiving communities. Originating communities, the ones who are in harm's way and need to be centered in their decision making. Receiving communities, the ones that represent where folks may go to. And in both cases, community-driven relocation is pertinent.
Yeah, I did want to just get into that just a tiny bit more in terms of managed retreat and why it might be important to change that language from managed retreat to something like community-driven relocation.
Well, there was an excellent deliberation within this committee about the challenges, the historic injustices in the Gulf region, and they're not unique. Unfortunately, those are not unique issues to the Gulf region, but that's where the study was occurring. When you have centuries of environmental injustices, and when you have displacements that have been forced over centuries for numerous reasons: structural racism, the displacement of indigenous peoples for colonialism, the challenge of having yet another mechanism to say, this is what we think you ought to do, or worse, this is what we think you people ought to do. When we have that kind of collective trauma and we don't raise that collective trauma on par with the technical assessments of, say, too much water, for example, or in California, too much wildfire, whatever it might be, we're missing a key component here. And that key component is the importance of centering, as we open this with John Den's comments, centering well-being and community decision-making, the collective community decision-making, individual household decision-making, in lieu of managing the retreat for people.
Thank you so much for that, Janice. That's something I hear a lot down in New Orleans and in Louisiana, so I appreciate you making that distinction. And Perry, I'd love to know from your perspective too, what does community-driven location look like? What would it mean?
I see a lot of parallels between that concept and environmental justice in general. And thankfully, there's a lot more attention now to further developing that, making sure that that all communities, particularly those that have been historically left out of conversations, have a seat at the table. And so when I think about community-driven relocation, I think about communities having agency and being decision makers, particularly for the decisions that affect them. And maybe importantly, what it is not is community financed relocation. Because we know that so much of those, the funding mechanisms or the changes in incentives and disincentives about building in harm's way will need to be structural policy changes and have sort of big financial backing in order to make the changes on the scale that's needed.
Yeah, what I'm hearing is maybe making sure that the financial onus isn't on the community in danger itself, but that it's more of a collectively shared cost, right?
Yeah, commiserate with where the harm is coming from as well.
Thank you. And just to dig in a little bit deeper into this report, we're not just talking about community-driven relocation at large, but also the impact it specifically can have on mental health and the well-being of communities, right? And communities that are already facing a ton of challenges, that are incredibly vulnerable to the risks of climate change. What does the research tell us about the health impacts that we're seeing in those communities? Janice, if you could go first.
Well, it tells us that we need to do more research because we haven't been prioritizing it. We know that there are health impacts from the literature that is available. The data tell us that the compounding stressors and the chronic and the acute events are, I mean, it's kind of like just being hammered on a regular basis. There is no room for relief. So while there's not what I would say a sufficient yet body of knowledge to establish the range of impacts, and I just don't think there's been enough study yet to say how deep does this go. We do have incredible knowledge about what collective trauma means within communities, intergenerational trauma means within communities. And so centering these conversations about hazards that force us to consider relocation, centering those around well-being would be such a foundational shift, because right now we tend to prioritize capital, right? So how much is this thing worth that's being damaged? But we tend to forget that the things that we're worried about being damaged are there in support of people and ecologies, ecosystems. So we're not putting well-being, we're not putting a whole of community perspective of well-being, whether for people or for the broader natural environment of which we are a part. So it would be a groundswell difference to be able to think about those things. In the conclusions in section 6, conclusion 6.1 and 6.2, we talk about those linkages more specifically. So really thinking about well-being and adaptive capacity. The way that you might begin to frame that is, are community members fully aware of the range of hazards that are impacting them? Do they have coping resources in place to support the situations that are happening right now, given the temperatures that you are experiencing and the storms that you had yesterday, for example? Do we have a way of thinking about impact mitigation? So what can I do at my household level to care for myself and my family? And if we can't really fix things in terms of impact mitigation, are we able to think more fully about adaptation? And if well-being is at the center of that kind of conversation, that framing, it's very, very different than saying, where do I get money to do this or that capital project? The other thing is about this issue that you had asked about before, where you have this kind of historic collective trauma that is not, it tends to not be included in, say, a vulnerability assessment or in a technical evaluation of the degree to which an extreme heat problem compounded with wildfire smoke, like you had out in the Western parishes last year, began to amplify challenges with housing quality and the ability to safely shelter at home. That's just one example. So these are critical changes that require us to put, say, Health and Human Services, CDC, experts like Perry at the table, a critical seat at the table, so that we don't put all of our attention on the asset and forget the reason for the asset.
Yes, Perry, I'd love for you to chime in here about what Janice just said as well.
I agree that we certainly haven't fleshed out all of the impacts yet, and more research could help tell that story and tell us what we don't even know we don't know. Using a parallel with something like lead, a common environmental health exposure, but we continue to sort of discover the extent of potential health effects or health associations with lead, even low dose lead exposure. And so here the exposures that we're talking about are climate driven disasters primarily, be that flood or extreme heat, and those impacts are already happening. I think about it from a perspective of pediatrician and thinking about child development. And we know that one of the most important things for child health, particularly after disasters, is reestablishing stability and routine. And that those are critical for wellness. And that routine could be the reopening of a child's their childcare center, the reopening of the school, the reestablishment of the public transportation networks that help the families get to where they need to be, or the reopening of roads or bridges. And so all of those things are critical. And really, even though I'm coming at it from a health practitioner standpoint, all of those sort of health interventions, if you will, are, engineering, city planning, much bigger picture than what happens within the four walls of a healthcare facility. And so broadening our lens as we're thinking about health to that public health, but then even sort of multidisciplinary solutions, and in terms of thinking about research and impacts as well. That's important.
Yeah, I am so thankful for that, because part of what really stuck out to me there was that you want to be thinking about what happens when people actually get to where they're being relocated, right? What kind of support are you offering them? And I was also thinking about that in terms of the report really emphasizes, when it comes to community-driven relocation, the need to let the communities have so much more opportunity to give input and actually help design their relocation versus it coming from a top-down approach. I wonder if you both could maybe talk about that a bit too when it comes to both on the front end of these kind of community relocations and also on the back end of when they've actually been relocating, the need to center the well-being of these communities in those situations.
Perry, do you want to go first?
Sure. One thing that occurred to me, so I'll come to the sort of thinking about the relocation. Well, it's all thinking about relocation. But one point is thinking about networks. And something you just said, Halle, made me think about, you said the transportation networks. And I had been thinking about, disrupted by disasters. And you were thinking about the importance of networks in the new place, in the receiving communities. And to some of the stuff that Janice has alluded to, and I think that the report does a really nice job of getting at, is there's all of these, in a sense, unseen networks that we can't appreciate because they weren't necessarily designed by governments in the first place or big systems, but they are the stuff that really makes things happen, like the social networks. And so, for example, when there are climate disasters and typical things are disrupted, typical routines. So say there's a closing of a school, but a parent maybe has a job that's still happening, or that is still a store that's still open, or whatever capacity, they need to go to it. But they can't go to it unless their child has a safe place to be while they're there. And so that friends and family network that might be the bridge. If that's been disrupted because of a relocation that has not taken them completely out of harm's way but has disrupted a social network, then we're sort of worse off than where we started. And so it's sort of just an example of why that would be so critical to sort of think about how we maintain those networks, or what's really in place to create resilience and buffering. And then in terms of sort of what we know about well-being when relocation is happening, I think we're at the very beginning of learning about that, and there are different bodies of work that we can draw on to try to make at least hypotheses and as evidence-based in decisions as possible. One study that was recently done that was not specifically about climate change or relocation, but it was about moving families, was the mobilizing the mobility asthma project that was done in Baltimore. And so basically families that were receiving government subsidies for housing were given a choice about staying in situ and receiving that subsidy or locating to a different neighborhood. And what they found was that across multiple measures of health and well-being, even though the project was initially focused on asthma, that they saw benefits to health. And so while there's also some concern about what sort of we're touching on, disruption of networks, we also know that some families might make the choice, and that ultimately has incredible benefits for their family if they're given the sort of the power to choose.
Yeah, thank you for that. And I did want to also ask Janice, in cities where regional governments are working on proposals for relocation or adaptation initiatives that will have big impacts on communities, can you talk about how well-being and community health is being discussed, or if it isn't being discussed in those rooms? And if they're not, what do you think the next steps are to get that going?
That is a very nice wiffle ball that you put there on that stick for me. I feel so strongly about this. Thank you. Thank you for the question. There and these are publicly available in the request for proposals, in all the ones that I've seen so far. There might be a nominal mention of something about social support, maybe, but most of the proposals for technical consultancies that I've seen at least tend to prioritize buyouts as a structural solution, sometimes include some level of land reuse planning from wherever the bought out property was. We should do something with this once the home is gone. Very infrequently include any kind of preparatory work for receiving community. Even the structure of the way buyout monies flow, I think it's something like you have a certain amount of money for relocation, but the guidance about where you should relocate to be safer in order to make sure that your well-being doesn't further denigrate, or rather, if you are putting yourself in equal harm's way because you found a property that you could afford given whatever the buyout was. So just the organizational structure of how to think about this tends to not include well-being. When we think about who would need to be in the room in order for that to shift, experts like Perry tend to not be part of the organizing communities within agencies at state or local levels. So there's that as well. So you might say, well, let's let's get some well-being into that work planning, right? But not having the right experts at the table would not even allow you to understand the existing context or to try to capture the social supports. And when we talk about expertise, Perry and other physicians, clinicians who understand this from a systemic level, critical, absolutely. But there's also the community voices, the household voices. And one way we've talked about this is the need to raise that expertise on par with technical experts who are nominally considered the experts, to truly understand what those supports are that are already in place that Perry was talking about, and the degree to which those are mobile on their own. Without a car, for example, a walkable connection becomes an impossible connection. The other thing that I think that's really difficult in this conversation is we tend to not put public health as a value when we are trying to determine what the existing context is. So we're not looking at chronic health issues besides what maybe you might see in a CDC report or ACS survey, whatever your data sources are. But are we actually taking the time to walk with community members to understand the experience, the lived experience on a day-to-day basis as various hazards are impacting those households, and what their resources are to deal with that? Because if you're not asking those experts on the front side, as your question started, on the front side of an effort, you're certainly not carrying that knowledge or those voices all the way through the process. So when you said, what is it like after? I'm not sure there is an after. When you think about any of us who've ever moved to a new city, it takes years to establish new routines. The habits and the relationships are not easily transferable if you're moving in significant ways. And those patterns, we know the literature is very well established on the impact of routines on seniors and the disruption of those routines. Like if someone moves from an individual household into assisted living, for example, is it possible for them to carry their routines with them? Well, imagine when that entire system of routines is completely disrupted. So while I think that there are some good things happening, and in the report we raise up an example of some task-based work sharing that could be amplified, in order to do that well, we have to have those experiences, those trusted voices, those individuals within the communities where these conversations are happening to be part of that effort.
Thank you for that. And oh, sorry. Please continue, Janice.
Like I said, I was like a wiffle ball that I really needed to hit, so I'm just going to stop there. Thank you.
You nailed the wiffle ball. It's out of the park. Incredible. I did want to ask just before we moved on to talking a little bit more about what can be done in the future. Could you just explain real quick for folks, just in case they don't know what task-based sharing is?
Sure, and give a shout out to one of our committee members, Gary Belkin, who raised this up. Our first recommendation is asking the HHS team to consider expanding and accelerating the adoption of task shared approaches. It's basically saying working with, for example, the certified community behavioral health clinics, is got an acronym for that, to help train up, promote, and situate community members and community-based organizations so that they can help provide services, health-related services, mental health services, and to facilitate that in a way that is not only about delivering the services, but about building kind of trusted networks over time. It's also an opportunity, at least in some of the conversations that I've been in, to train up home-based health workers and to also engage multi-generational voices, like the seniors who are kind of the always watchers in a community, to be part of that conversation. So there are multiple benefits to be captured. And I think Gary's point of bringing this to the committee was to say, we have a mechanism. That mechanism can be expanded. And in doing so, there are multiple cascading benefits that can come from it.
Thank you. Yeah, and I did just we're going to try to open up for audience questions in about 10 minutes. So audience, please feel free to submit any questions you have to the Slido throughout, and we'll be getting to those. Okay, so just to talk about next, Janice, in the context of health and well-being, how do we address the additional challenges that are presented by movement across political jurisdictions, or across health networks?
How do we address the movement across jurisdictions?
Yeah, the additional challenges presented by people moving maybe out of state or across different lines.
Sure. Well, I think that one of the key parts here is to think about, are there existing collaborations, interstate collaborations that are underway? And in the Gulf, we were not able to identify a particular set of mechanisms that were already in place for that. So, and it's not just across state lines, but it's across county or parish lines as well, right? So when we think about the way money moves through municipalities, or the way money moves through a state, there are pertinent issues that need to be negotiated. Even in a recent example that we worked on in Houston, in order to move people out of a repetitively flooded area on the north side of Houston, they would to a higher ground area within a 10-minute walk. They crossed the line. They crossed the county line. And that would mean a negotiation between the city of Houston and Harris County in order to come up with a payment mechanism that would allow the city to pay the county if the new home was more expensive to rent than the ones that were chronically flood prone. So there were those kinds of negotiations that needed to be made. And in the case of the study, there are recommendations where we are asking agencies to begin to develop these collaborations. We've highlighted the importance of regional coordination. So if you imagine, just for the Gulf, a 5-state regional collaboration that says we have a lot of folks exposed. If we looked at just the hazard of sea level rise, we have a lot of folks exposed. The scale of the threat is enormous. How do we prepare for the kinds of changes that are necessary? And what are the policies, ordinances, or programs that need to be adapted for that? But those conversations aren't happening yet, so the ripple effect isn't quite clear. And then the last piece of that is really thinking about, how do you know if you've done well? So what are we actually monitoring? What are the indicators that we're tracking? What are the metrics that we're considering? And then how do you sustain more of a longitudinal look at that over time? So if we have some baseline health measures and we see over time that the health measures are improving with those changes by comparison to those health measures declining. And then in the planning section, which is in recommendation 3, we're talking about the importance of moving from a situation where the partnerships are more kind of based on a disaster response cycle and more toward building lasting relationships between organizations. So partnership building and there's another recommendation where we talk about year-round funding to allow for these sorts of things to happen. We talk about co-creation, and that word gets thrown around a lot, but we really do want to emphasize the importance of these connected parts. And then that it's not just agency or government that needs to do this. We need community members, community-based organizations to be involved. So I'll stop there. I think we've hit most of those, but we have a lot of recommendations in this report, and I've only touched on a few of them. Recommendations 3, 4, and 5 are particularly pertinent.
Yeah, it's a very comprehensive and extensive report. So hopefully people do go check out the full report after this. Perry, we've made clear you're coming at this, especially with a lens of children and children development and mental health. I have a multi-pronged question for you. Many questions. Could we maybe start by you just kind of giving a picture of if there is any existing framework in terms of policies that relate to how to properly relocate children? Is that something that already exists? Any initiatives around that? And it's okay if the answer is no. I'm just making sure.
Not that I'm aware of, but would happy to be corrected on that. And I think, and we do know a lot in terms of what child focused framing could or should look like. So I'm happy to say more about that, but give me the other part of your question and I'll sort of see where we go.
Yes, definitely. Okay, I just wanted to make sure we had a baseline, and the baseline is minimal right now, correct? So can you kind of just talk about, refine what child-focused framing could look like? How can we start to ensure that mental health and community well-being are included in discussions that are involved with children?
Yeah. So I bet that everybody listening to this is aware that we're in a youth mental health crisis in this country that's been emerging. Certainly the seeds of it were pre-pandemic, and the pandemic really exacerbated it. And climate calamities are going to make all of that worse in terms of destabilizing children's routines that I already referred to, and also just bringing generally greater stressors to families, and many stressors to families center around healthy housing. So safe, affordable, stable housing. And if we can figure out how to support communities to have that, and to have that when and if they relocate, we're going to be doing a whole lot of good for children's health and well-being, and that includes their mental health. So that in a nutshell, and I think it comes down to thinking about it. So the child framing part of it is thinking about where children, live, learn, eat, sleep, play. And if we're thinking about that, and we're sort of oriented not only to children, but sort of thinking about the heterogeneity of our populations, and that we are trying to figure out that they're, who the groups are. So the child-focused framing is sort of a first step to thinking about elder care, like Janice was mentioning, and all the impacts that that relocation has on older adults, but any other group, and sort of thinking about what are the local tailored needs, and so making sure that not only community has a voice, but that we're in a sense maybe using a data-driven approach to think about what subgroups within a community there are, and making sure that we are gathering the information in the first place to make sure that we're accommodating those needs.
Yeah. I wondered, just because you mentioned, when you have a child-focused framing, you can also have an elderly-focused. These are both groups that are incredibly vulnerable, probably some of the most vulnerable to the effects that we're experiencing. Can you, Perry or Janice, talk about if there's benefits to focusing our efforts on what's needed by the most vulnerable, if that then extends benefits to the general population that could be affected by relocations?
Yeah, I think it's a muscle that we do well to develop, because it's a lens that makes us more facile. Part of the reason I went into pediatrics was because of the variety of patients. I have had patients over my time that fit in the palm of my hand to some who outweighed me by 3 times, and those were all pediatric patients. And so so pediatricians by nature have to be, sort of prepared to deal with, patients who are completely nonverbal to those who are effectively functioning like adults. And so similarly, that kind of framing in our planning, in the way we engage communities and thinking about the variety that exists, and then orienting it to sort of the groups that, as you said, potentially have the most vulnerabilities, ultimately serve us all well because of that interconnectedness. Because if you are a primary caregiver for a parent with dementia, and their the home health care person can't make it to the home, then you're not leaving to go to work that day. And so thinking about sort of our interconnectedness that we have to plan. Pets are another one, not necessarily thinking about pets as a vulnerable population, but people who have pets. If you don't have evacuation plans during disasters, for example, that accommodate or centers where people can take their pets, understanding the power of connection that people have with their pets. I mean, basically you have a failed evacuation plan if you can't take your pets, because for that population of people. And so thinking about those connections are critical.
Thank you, Perry. And just to let the audience know, we are going to start Q&A soon. I will just ask one more question and then turn to audience questions. Just for both of you, when it comes to relocation and mental health, what do we know about, do we know enough about how to act going forward, and what is still needed from the scientific and policy community?
Maybe I'll go first. I think Perry certainly raised up quite a bit of what we do know. And I think the gap may be the connection between the issue of relocation and what we know about well-being or mental health. Right? So the range of climate hazards has not really been crowded in appropriately. The things that jump out in terms of what we need, it doesn't feel like there's yet a welcome conversation with municipal leaders too frequently, not all, but too frequently. It's not popular to say we're going to need to reconsider whether or not we keep living in this place, or we're going to need to reconsider whether or not we can continue to provide services. So the idea of it, like, what does it mean? The fact that we spent so much time, even as a committee, deliberating the term to use, much less what is the purpose of it? How might it work? What are the different ways it could work? Where has it worked? That kind of socialization of the challenge, the way that we characterized it in the report, was trying to raise up the scale of the threat in order to motivate action. And when we think about talking to scientists to begin with, or researchers, there's an excellent communications person, a storyteller, who did, I can't remember her name off the top of my head, but she did this exercise where she asked kids to draw what a scientist is. And it's like people in a white coat, and they have funny little glasses and maybe a pocket protector, and maybe they have some gizmos. But then when the kids had a chance to sit with scientists and talk and actually the real people to real people, then there might have been the kind of cool scientist who's wearing a flannel shirt and she's got a great cap on, and all of a sudden it's a person talking about an issue as opposed to a scientist or a researcher who's separate from the issue. And it feels like we have this problem when it comes to climate related issues and maybe even health issues. Perry can speak better than I, but certainly when you put the two together, we have a real problem with the communication issue. Right? We haven't socialized risk in this way well enough. And we also don't think about it in terms of crowding in those other voices that we mentioned. It's research, or it's a practical project, or it's community engagement. Like, I'm going to go do community engagement, as opposed to thinking this is a whole of community sustaining relationship that we need to nurture and be present for over time, over the generation that has to make this transition. So that kind of participation from all parties, a kind of the accuracy of making sure the seats at the table are truly inclusive, and for those who don't have capacity in their days to even come to the table, that there are other ways of being involved. That needs a lot of work. And then the last thing I will say is, dealing with these issues is not a new question. I mean, we have histories of, and we open this call with acknowledging, this webinar with acknowledging Native communities who were here before or there before. And that knowledge is somehow lost. So it's not just how people are living in the place now, but how people have lived for generations. One of the panelists at our community release event had to delay her return home because it was dark and her community is only accessible by boat. So she knows a way of living over many generations in a place that is only water bound. So how is that knowledge part of this conversation as well? So those are some of the things that I think we need to work on, and equity is at the center of this, right? It's a question that says we need to not devalue something because it's qualitative or local in order to overvalue something that's scientific, right? There has to be a pairing of the two. We got to bring them together like peanut butter and chocolate.
Like peanut butter and chocolate. So to the question of, do we know enough to act? Yes, we certainly know probably more than we need about the why to act. I would argue that we also have a lot of tools about the what we need to do, and maybe we have some gaps around the how, and that's where the community comes in, because I think it's irrefutable that people need healthy, affordable housing and to feel safe in their surrounding communities and all the other systems that support that. We know in those houses, we want to reduce indoor air pollutants and make sure that there's not mold and that the nitrogen dioxide levels are not too high and particulate matter levels are not too high, all those whats. But the how, and making sure that people are cooking on stoves that they feel familiar and oriented to, that they feel that they're able to clean with the kind of cleaning chemicals that they feel confident are making their house clean in the way they want it to be, and that they're able to afford to cool or heat their space in a way that is going to help them sleep well, and all the interconnections that has to health and well-being. And so, but how we get there in terms of, it really requires that community input to sort of the implementing part of it.
Yeah, thank you. And I did want to ask our first audience question. Very exciting. You guys have some really great questions. There are so many, it's going to be hard to choose. So I'm going to start with this one. I was wondering, how can we ensure that opportunities for relocation are distributed equitably across potential quote unquote receiving communities rather than falling disproportionately on communities already experiencing environmental or economic injustice?
I think this is one of the places where I'm going to do a little Gavin Smith channeling. Gavin was a strong advocate during the committee study to bring more land use, land suitability analysis forward. So part of what that needs to include is not just the physical side of this, but really understanding the socioeconomic situation. And Deborah Butler was a very strong voice. I think her prior doctoral research captured some of the challenges of the near coast communities, for example, being short on critical resources to absorb additional community members. So it's not just the issue. Let me back up. One way of thinking about this is thinking about where receiving communities could be, where we are not putting people in harm's way. Right. So if I'm going to move from a place, for example, that's flooding excessively, I don't want to move to a place that's also flooding excessively. I want to move to a place where my family and I will be safer. So when we think about that, we have to think about the vulnerability assessments that look at what is available to either densify higher ground to improve the situation. But land suitability analysis, the ordinances that are in place, the physical characteristics of the land, the access of resources, the systems that serve that, that's again only capital, right? We're not thinking about social. So when we think about this in terms of social issues, we also have to think about, are there jobs available? Are there schools available? Is there healthcare available? Is there a continuity of systems that would allow community to densify without inadvertently gentrifying, negatively gentrifying and displacing those who already live there, or without worsening the conditions of those who already live there? So we really need to think about this far more holistically. And I think that's why the originating community or community members and the receiving community or the receiving community areas or receiving community members, example of that in Houston, need to be co-present in these conversations. It's almost like a loose handshake to say what's going on in these two places and how might we make it better. The example from Houston that I think I understand, I'm not sure I'm going to quote this right, but I believe the city was trying to determine whether there could be almost like a density bonus. So if you had a large parcel, could you add some additional dwelling units on that parcel and densify high ground without having people have to move far away from, say, the school where their kids was going or the hospital where they went for care? So those kinds of handshake conversations, I think, are going to be very critical. But the analytical side of that, to say how are the systems supporting, as well as how are the assets, the potential relocation sites supporting the potential for density or potential for new development, while we're also protecting areas to do ecosystems work for us.
Thanks, Janice. Yeah, that is something that I've noticed down here in Louisiana, especially after Hurricane Katrina. We have a region just across the lake called St. Tammany, and that area experienced a huge population explosion and weren't necessarily prepared to be a receiving community. So I can understand where that question is coming from. And Perry, did you want to add?
I think the fact that we're having a conversation and using the term receiving community and honoring that as a network in and of itself, I think opens the possibility to have conversations with those receiving communities about what they need, because the possibility of having an influx of a population could, under the right circumstances, be an incredible opportunity for some communities. And so understanding that there's certainly carrying capacity within given infrastructures, and that social networks need to be respected as well. And so so I love that we're having the conversation in the first place. I love talking to and being in conversation with Janice because she knows about such cool programs like the density bonus conversation in Houston, and just sort of that some of the sort of creative solutions are that there are already examples of those. And so there's things we can look to if we have the right sort of learning communities and dialogue happening between some, municipalities that are facing similar opportunities or challenges. And so I would just close that thinking that if we can shift the dialogue around sort of that it's from burden to asset, right? That if the receiving community, that it's potentially an influx of assets, not only the human capital of people who might relocate there as assets, but also if the whole framing around relocation comes with opportunities to do city planning in a way, or redo city planning because it's needed in so many existing communities in ways that can be cooler, more walkable, quieter, cities that have better, can deal with better stormwater runoff, just all of those things that sort of need to happen anyway in the setting of our energy transition. Then I think it could change the whole tenure.
Yeah, it becomes, like you're talking about with proper planning, an opportunity rather than a burden for that receiving community. Thanks for that. Yeah. And I wonder, we're kind of switching gears a little bit. All right, there's one question from the audience asking, are there structural changes to the healthcare system that might help with well-being throughout and after relocation?
I hesitated to go first here, Perry, because this is your ball game. But the one thing that came to mind when I saw that question was an example. We were working on a project near Nairobi where community members were highly mobile, so tribes moving. And one of the things that just felt so innovative to me in that conversation, and so for all the healthcare experts who are about to cringe, or the insurers who are about to cringe, one of the things that felt so innovative to me was the idea of this highly networked health record system that would allow community members to go to any clinic that they might walk to, as opposed to having to be tied to a particular system. And while I don't think we have that mechanism here, at least I haven't found it in my healthcare portals, it's innovative to think how we might allow for that much more interconnected records management, so that the physicians in one location, physicians in another location could have a level of interoperability on patient data, and in the intakes also consider the kinds of climate and related hazards that those patients have already been exposed to.
You said what I was going to say, but maybe even better than I was going to say it. And I was thinking about the potential of electronic health records and to the interoperability. I mean, what we saw such, post-Katrina, such disruptions in particularly chronic care management because health records were paper. Right. And so people didn't have access to refills. They had to reestablish care, which, and so figuring out how to make both in disaster settings, but then also, I mean, it's such an opportunity in relocation planning to think about, wouldn't that be cool if you could make that one less thing that people had to do if they're moving, and that they, are asked proactively, where would you like your medical records sent? And we're going to transfer all of your prescriptions, or they've already been transferred, so that you can pick up what you need, or whatever the specific healthcare needs are. It seems like it could be a very cool proactive intervention.
Yeah, I would just say jump back in here if that's okay, Allie. One of the things that's just a real joy to me is every time I go to the doctor or the dentist or anyone who's kind of working on the frame here, and I say, how are you thinking about climate change in your practice? And so far it's been, Well, I haven't. And I just think that, I think it was Cheryl Holder who said, we need to make that part of our hello, right? How do we get to know a patient? Or she had given an example in one of the Florida physicians conferences about a patient who was exhibiting certain symptoms that were not easily identifiable as a source from being exposed to heat at night, so inability to sleep. And Perry would know more about what the technical terms for that are, but I just thought, how many of us in the conversations that we have with our physicians ever talk about what our ability to be at home safely during different climate conditions actually is, and whether or not different climate related events or otherwise have inadvertently exposed us to issues. Just last week, we had this conversation with a community in Bridgeport, Connecticut that was living in a set of apartments where no one had screens on their windows. So they either had to be hot, spend more of their food income on energy bills, or have the window open and have mosquito bites. So that's a very tough decision. And it feels like having the healthcare team be like Perry and have climate central in the conversation, and to think about health within the physical environment decision making. Screens on windows would be massive changes.
Yeah, and I did, in the vein of our continuing our conversation around equity and putting that at the top of some of these discussions, we did have another couple great questions come in from the audience. One is around a different vulnerable population than we've necessarily talked about so far, and that's how do we proactively prepare for potential unhoused migration? Janice, I wonder if that's something in your wheelhouse.
I am not an expert on unhoused populations. I can tell you that here in New York, where I am today, when we had some of the severe temperature drops this winter, we had families using tents in kind of a camping area, and there had to be kind of an emergency response to that. Where you are, I know there's a big shelter under I-10, or at least there has historically been. So the one thing that I would say is I don't feel that we are aware at a city or community systems level of the range of challenges that we might have as unhoused families or individuals need to find that shelter, whether it's during an event or simply need to find safe housing, as Perry was mentioning before. It doesn't feel seen enough on the heat side. I think even in today's times, there are the stories coming out of Phoenix about more attention to that. I know Kirsten Dow, who's a researcher in at University of South Carolina, working in the city of Columbia, has been doing some direct outreach to unhoused populations there to say, what are you actually doing when we have these extreme heat peaks? But it still feels underattended. I can say that heat.gov has an excellent resource on this issue from the webinar they did this winter. So just point folks to that and the experts who are on that panel. But Perry, you may have more expertise than I do on this one.
No, I think it's a good question, and it made me think about the services that are being offered for the unhoused population, and that needs to be part of the conversation for receiving communities, and making sure that whatever systems are needing to be bolstered, it would include those as well, if there was an expectation that the originating community would be a mixture of housed individuals and unhoused individuals.
Yeah, and well, I wonder in that vein if we could this question kind of zooms out on a specific group and more just asks, how can marginalized communities use their agency to decide relocation when they're disadvantaged to start with it in general? If you all have any tips for that.
This is such a hard question. It's a great question, but it's a hard question to even begin to
unravel.
Well, I'm searching for the verb because it feels like it's inappropriate for me to summarize what a marginalized community means. It feels like I've already stepped across an appropriate boundary to sustain, which is to say, when you are a member of a community that is in some disadvantage or marginalization or another, how do you see it? How do you want to think about this? And do you have the information and the resources that you need to even have those initial conversations? And it feels like through some lessons that we're learning with collaborators up in Connecticut, the way that we have conversations, the care and the thoughtfulness of who is leading those conversations, and the way that community members are part and invited to and compensated for their time in those conversations needs to be an early starting point. It feels like I don't know enough to even characterize that. Like I would somehow be shortcutting a critical process if I suggested a way as opposed to learning what the preferred ways might be.
Mm-hmm. I can understand that. I mean, you're talking about communities using their own agency, so why would you want to dictate how they should go about using that agency? I can understand that. Perry?
Yeah, there's the saying that the system is perfectly designed for the outcomes it's getting. And so I think when we look at any things that we as a society have not gotten right, or populations that have been, as the question said, the communities that are historically and present current day marginalized, then I think it takes being accountable to that history in the sense that we haven't gotten it right so far, and so we need to try something else. And I agree with Janice's response that it takes, you suggested, Janice, sort of some different approaches in terms of how do you make sure that people are represented, different voices than historically who've been represented in decision making, and then how not only just sort of lip service to that, but like compensation for that value of that knowledge that's being brought. Not that it's doing a favor to those communities to allow them to speak, for example, but that it's ultimately potentially going to result in more effective solutions.
Yeah, and I did just I'm not sure we have enough time for any more audience questions, so I was going to ask just our final wrapping question. I really appreciate everything you both have said so far. I think that you've given a lot of important nuggets for people to think about. Just as a final question, what are some actions that people can take to further this conversation?
Perry, do you want to go first, or do you want me to go?
Go ahead.
Well, definitely ask your doctor. You need to be thinking about what are the issues where you live. If we don't know how these challenges affect us at the individual or the household level, then it makes it very difficult. It feels like somebody else's problem. If you're part of a community that might be a receiving community or is already becoming something of a receiving community, what's happening there? How's that working? Are you able to be involved in some way, have the conversation with your neighbors or with your council members or with whatever social organizations, religious organizations that you might be part of? It feels like sometimes we talk about these things in a way that it objectifies the question. But in fact, this is just about us and how we live on this big blue ball. And when we think about how we are choosing to live and designing, in the broadest sense of that term, the way that we want to live in the future, we have to be part of the conversation, right? So I grew up in the South, and in the South, help starts at home. So asking myself or asking my family, where are we in this conversation? Do we know what our own health risks are? Do we know what's happening with our community members? If you live in a big place like I do, you could say, what's happening on my block, or what's happening within a 10-minute walk of my home? Is there anything there that I need to know more about? And it feels like if we could kind of break this down into something that's pertinent to the individual, we can begin to de-silo the expertise, get those scientists in those kind of cool flannel shirts and caps instead of in the white coats, and really build some bridges. Like in New York City, for example, the mayor's office is running something called the Climate Knowledge Exchange, and it's bringing in lots of community members to talk about a range of issues. And while not all communities are able to do that, I know that it's pretty easy to catch up at the dog park or at the grocery store. And that's the level of socialization of the conversation that I hope for, whether it's with your doctor for an individual conversation or with the other touch points in your life, where it doesn't become that thing that's out there, but it's something that we're all dealing with, and we all have a role to play. And whatever kind of expertise you have, it matters. So kind of finding a way to make that fit in.
Yeah, Perry.
Yeah, I think, none of us are the whole fix to this problem, but every one of us has something, and whether or not it's as sort of simple as being the catalyst that you ask your healthcare provider, and catalyze that conversation, or for people who are involved in children's lives, catalyzing those conversations at school, or being supportive of when they are being catalyzed, reinforcing the why. Janice, you mentioned earlier in the conversation that it was not popular maybe to talk about relocation, and the municipalities aren't, and I would argue also that it's not intuitive, and because the scale of some of these things that we need to do, people don't necessarily think systems wide and certainly don't think about relocating entire communities. That's sort of beyond our temporal and spatial scale and what we typically think about. And so that's daunting. Even though we now know rationally and that we need to have these conversations, but sort of easing our own selves, giving ourselves some grace, and thinking about the emotional impact of thinking about the climate crisis. When I was first getting into this work, I was trying to read up on it, and I had a book that I was reading before I would go to sleep, and I was having nightmares, because this is some of the stuff, especially when you're thinking about the impact part of it and not the solutions, is scary, right? Just to think about it is scary. And so I stopped making that my bedtime reading. It didn't mean that I went away from it completely, but just sort of honoring your emotion. And when it's disturbing your sleep, you've got to think about some self-care. But that we all have a role to play, especially if we can take care of ourselves while we do it.
Yeah. And I think that we are wrapping up because we're about at time, but I did just want to add as well, and also in the context of that conversation around marginalized communities using their agency when it comes to relocation. In Louisiana, we have one of the most famous cases right now, right, with Ile de Jean Charles relocation, and how that was state supported, but there's been some clear changes from what the indigenous tribe leading that relocation wanted and how it ended up. And so something that when I'm talking to environmental justice leaders, their advice is often, help be the watchdog while these processes are going on. Be involved in that accountability. And when something's starting to maybe go awry, be willing to lift your voice up. And that's what I hear from them, at least. So on that note, I'd love to turn it back over to the National Academy of Sciences staff to close us out. Thanks, everybody.
Thank you, Halle.
Thank you so much, Halle, for moderating this excellent conversation. And a huge thank you to Janice and Perry for sharing your incredible insights today. To our audience, thank you so much for your interest and all of your excellent questions. This conversation was recorded and will be available to view on the same webpage immediately after we end. I would also like to give a big special thank you to my colleague John Ben for all his hard work and efforts in putting today's climate conversation together. Looking ahead to summer, I'd like to highlight a few events that we have on the horizon. First, our next climate conversation webinar will be at the same time on Friday, June 28th, and cover one of today's biggest energy topics, which is hydrogen. Registration will go live shortly, so be sure to subscribe to our newsletter so you know when it's open. Next, I'd also like to promote our upcoming Climate Crossroads Summit, which will take place July 16th and 17th, both online and in person at the National Academy of Sciences building in Washington, D.C. This year's summit consists of multiple sessions and breakout discussions touching on many aspects of climate, including international cooperation, resilience, and decarbonization, with an overall focus on solutions. Registration is free and open to the public, so learn more through the link that we'll post in Slido or through our newsletter. If you'd like to share feedback on today's events or ideas for future events, please take our survey. Thank you all for joining, and we'll see you again next month.